Thank you, Caoirleach. And I too would also like to talk this morning about the Health Committee, the Minister for Health, commencing the Phase 1 of the review of the Health Regulation of Termination of Pregnancy Act 2018. I find it a little bit ironic that Senator O'Reilly was talking about animal welfare straight away after talking about abortion in this country this morning, and she had no thought for the welfare of the unborn, but she was thinking about animal welfare this morning. I find that slightly ironic. There's very legitimate concerns that the government's 3-year review of the new abortion laws will be a missed opportunity. To date, the Minister of Health has only met with abortion supporting groups about the process. The public are entitled to better than a pretend public consultation process that has all the appearance of listening to people's concerns, but is in fact nothing more than a public relations exercise with a pre-arranged outcome. The Minister must demonstrate by his actions that he is not listening to just one side of the debate. The 3-year review must look at Ireland's spiralling abortion rate as a priority and at other troubling effects of the new law, like the fact that there are no protocols in place on how to care for babies that survive late-term abortions. 13,243 abortions took place in the first 2 years of the new law coming into effect in 2019. That's a massive 70% increase in abortions in 2 years. The government's 3-year review is an opportunity to scrutinise what has happened and ask some really hard questions about the new law and the changes that are needed. The recent finding from Amórach research shows that 89% of the public support women being offered information about alternatives before proceeding with an abortion is a welcome finding. Another important finding from the recent published Amórach poll is that 77% of the public support an amendment to the abortion law to ensure that babies who survive late-term abortions are given medical and palliative care and not left to die alone. The government has already acknowledged that it is aware of the UCC study pointing to the fact that babies have survived the abortion procedure under the new law and have been left to die unaided. 1 in 3 people voted for abortion in 2018, and the recent Amórach polls show that an overwhelming majority of the public backs proposals to be put forward by the pro-life movement as part of the 3-year review. The government needs to acknowledge this support and invite pro-life representatives into the decision-making process rather than shutting them out, as currently is the case. So I'm hoping that the new chair that is appointed next year will take the pro-life views into consideration. Thank you.
Senator Keogan rose this morning again to speak about the review of the abortion legislation that was announced by the Minister for Health. Senator Keogan, you did make some comments that I feel are appropriate to address directly. You said that it was a pretend public consultation process. I have to reject that comment. You said that the outcome was pre-arranged. Again, I would reject that assertion. It's not pre-arranged. You said that there were, you drew inferences that there was over 13,000 abortions in the last 2 years, representing a 70% increase. I would suggest you probably haven't taken into account that many of those women would have travelled, so those abortions would have happened, but happened in a different jurisdiction, that being the point. You also said that a third of people voted for abortion. Actually, no, over 66% of our citizens voted to remove the 8th Amendment. That's the factual position. That's 2/3 actually of the country. But I would agree with you in the need to have the views of people with a pro-life position, that those views should be facilitated, should be given a space to be articulated, should be respected, and that we do everything we can to ensure that the review is done in a respectful way, in a balanced way, and that it is credible and legitimate. So we do agree on that point.